So you're thinking about getting canine bites done. Well, I'm going to let you know all the things you should know before getting it done. Coming up next on Consultations by a Piercer, episode number 34. For those who are new to the channel, first off, welcome to the channel. Hope you're finding the videos helpful, informative, and all that fun stuff, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So what we're going to be talking about today is yet another lip piercing grouping. There's a lot of them, and we'll be going over those probably for a while until we can move on to something else. So I might repeat myself a lot if you watch every single video. It's okay if you don't watch every one of them. But what is Canine Bites? Canine Bites is actually 4 piercings. It is 2 on the upper lip and 2 on the lower lip. Basically, angel bites and snake bites. The combination creates what is called canine bites. So how long do them things take to heal? You're looking at an average healing time of anywhere from 8 to 12 weeks, during which time there's kind of a two-parter on this one. You want to clean the outside twice daily with sterile saline spray. Personally, Neomed's piercing Aftercare because it comes out in a fine mist, but it's not available everywhere. You can usually find comparable stuff at good pharmacies. The things you want to look for: first off, it should be in a pressurized can. Second off, should say sterile on said can. When you turn it over and you look at the ingredients, it should only say, and I repeat, only say sodium chloride or salt in purified or distilled water. It should not state any chemical names or anything that you don't recognize, or grapefruit or tea tree oil or any other nonsense. There's no reason for any of that, and it can actually cause issues. Now, there's 2 delivery styles. There is the kind that comes out in a fine mist, which is my preferred delivery. And then there's the kind that comes out like a squirt gun. Now, if it's the fine mist, you just mist both sides, let it stay in contact for about 5 minutes. You're done. Blot off any excess. If it's a guy that goes out in a squirt gun, you're probably going to want to do compresses. To do that, take a sterile piece of gauze sponge. If you don't have that available, then a clean folded up paper towel can work. Saturate it to the point where it's damp, and then lay it against the piercings for roughly about 5 minutes. You want to do that twice daily. One other thing I generally suggest doing is at the end of your shower, pull your hair and everything out of the way, tilt your chin out, and let the water flow over the piercings for about 30 seconds. What we're doing with those 2 things is we are breaking up that discharge that hardens and collects on the jewelry, the crusties. We want to remove it so that if the jewelry shifts or moves, it's not going to agitate the piercing, and it's going to be more comfortable during the healing process. Now let's talk a little bit about what I suggest for the inside. For the first couple weeks, I suggest rinsing twice daily with an alcohol-free antiseptic mouthwash. This is just a precaution. Do it once in the morning, once at night. Think about it, it kind of revolves around when you're brushing your teeth. 30 seconds rinse is more than enough. Personally, I like Biotine antiseptic mouthwash. Also, you can kind of make things feel a little bit better by doing warm saltwater rinses with warm water in sea salt. It should be roughly 1/8 of a teaspoon per cup of warm water. Now let's talk about cross-contamination prevention. Common sense things. Wash your hands before you handle it. Always handle it by the ends whenever possible. Really, the only time you need to have any contact with this piercing or these piercings is when you're checking the tightness of the ends. The rest of the time, leave them alone. No oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks. You are more acceptable to STDs during oral sex, so if you switch partners, practice safe sex the way you're supposed to, which means latex barrier. Do not stick unclean objects in your mouth, like pin caps, toothpicks, dirty fingers, other people's dirty fingers, that stick you found on the ground, or for you hay seeds, that hay, I guess. Do not share food items or utensils with other people. Make sure that your own utensils are cleaned on a regular basis. It's a good idea to start with a fresh toothbrush just to be on the safe side. Now, keep your environment clean. Clothing, bedding, towels, anything that may generally come in contact with the general area needs to be cleaned on a regular basis just to be safe. Do not submerge piercing in bodies of water you cannot control the quality of, which is pretty much everything but your own clean bathtub. So, in other words, no, you can't swim. I know a lot of people you're gonna get a lot of conflicting ideas on the internet. The reality is, any body of water that you can stick your whole body in and move around in is going to be filled with microorganisms. You have, in this case, 2 to 4 different open wounds on your body. Chances are they can work their way into that piercing and cause an infection. Keep pets away from it. Don't let them sleep in the bed with you. Especially them smaller animals like to sleep up by your face and do whatever they do in the nighttime. Now let's talk about trauma, swelling, and abuse. Do not sleep on the piercings. Make sure you're sleeping on basically flat on your back or figure out a way to elevate them off the pillow. Do not spin, rotate, or move the jewelry. Do not play with them. They are not a fidget spinner. Swelling is always a factor whenever doing oral piercings. It can last usually about 3 to 5 days. So for the first 3 to 5 days, I do suggest cutting down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, or anything that may agitate the piercing. General good rule of thumb is if you ingest something and it hurts, don't do it. Now, you're going to be dealing with 4 piercings if you do all these at once, or a minimum of 2 piercings in most cases. That can be a bit to deal with, and that's a lot of real estate to avoid contact with. It also is a lot of movement when you talk, eat, etc. So having kind of a simplistic diet and cutting down on the amount of speaking that you're doing during that swelling period is going to help reduce the time that it's swollen and also the amount of swelling you see. Soft foods are always best when it comes to oral piercings, at least for the first 3 to 5 days. Things like baby food, applesauce, smoothies, cold items like popsicles, ice cream is good too, and yogurt, baby food, applesauce. All that fun stuff is going to be a better option than, let's say, a steak. Now, if you've never had any issues using over-the-counter anti-inflammatories such as ibuprofen, it shouldn't be an issue to take that to help with the swelling. When in doubt, especially if you take other medications, it's best to talk to your physician before taking anything. Lastly, sleeping with your head elevated above your heart will reduce the amount of swelling. Usually we see the worst of the swelling first thing in the morning, so also another thing you can do is stay hydrated throughout the night. Once the swelling goes down, you can slowly start to wean yourself onto solid foods. Now, this isn't as intrusive as, say, a tongue piercing is going to be, but it's best to take your time and be patient. At first, it can be very frustrating, but over time, you're going to quickly realize that your body's adapting to it, you're getting used to it, it's going to feel stranger to have that jewelry out than to have it in. That and life just generally gets easier once you downsize the shorter barbell or shorter post. In most cases, I generally suggest doing that in roughly about 4 to 6 weeks. Sooner if it's causing issues, if you're having a lot of contact with your teeth and gums. A little bit about the risks. Now, any oral piercings have the risk of enamel erosion, gum erosion, and softening the bones inside your mouth. Because there's 4 piercings, there's 4 times the amount of risks. The other problem is usually to get these to make them look like they align or they're matching, we have to slightly play this game of which is going to work better. Is it going to look better this way versus what's going to cause or reduce the amount of contact the jewelry has? And sometimes it's kind of a balancing act. So this piercing or these piercings are more of a higher risk than other oral piercings. The other risk would be swallowing parts that come unscrewed. This one, usually oral piercings, lip piercings, I should say, usually don't have a high risk. You just need to check the ends on a regular basis. Now let's talk about placement, angle, and jewelry. Now, you should always discuss your end plan with your piercer before they begin to mark. If you are planning on wearing rings and maybe the bottom holes, you need to talk to them about that. If you want to be able to have that flexibility of switching from post jewelry to rings, or that's something else you need to talk to them about. It's a lot easier to adjust these things during the marking process and placement process than it is to do it after the piercings are healed, to try to adjust to other jewelry. Now, usually I would suggest only doing 2 of these at a time. Do your angel bites or do your snake bites. Don't try to do all of them at once. Your body usually cannot handle, most people's bodies can't handle more than 3 piercings healing at one time. It's the general standard when it comes to body piercing. Each time you get a new piercing, you're kind of taking away from your body's ability to heal quickly and avoid infection. So it's usually best to do these in maybe stages. Now, when you're marking out the piercings, you want to go ahead and mark all of them so that you have a clear understanding of how they're going to look and work on your face. It's a good idea to take a photo of that so the next time you stop back to see your piercer, he has a good idea of where those markings were. With both of these, we generally line them up with the edges of the nostril on both sides. Understand that nobody's face is perfectly symmetrical. Nobody's body is. It's more about making them look like they match than actually physically matching them. So always take that into account when you're looking at markings. With these, you're probably going to have, your piercer's going to probably have you make some funny faces to kind of get an idea of how much you move your mouth. Maybe they'll be watching you when you speak. They might ask you a few questions. Kind of to get an idea of how much movement there's going to be and where it's going to look best on your anatomy. When you're looking at the marks, look up close just to get an idea, but always look at full length because most people are going to see you at arm's length or further, and that's the majority of the people that are going to see the piercings. So if it looks like it matches at that stage or that distance, they're going to be less likely to go, no, those are crooked. Now, angling. Usually if you're going to do basically just stick with stud-style jewelry, these are done straight through the mouth or straight through at a 90-degree angle to the tissue. If you are only going, and I repeat, only going to wear rings on the bottom, then they can be angled so they're more outside the mouth and have less contact with teeth and gums. You can have the option, however, if you want to switch back and forth, then the angle or placement on the bottom should be higher to make sure that you can fit a smaller ring around your lip. Common jewelry with this one is labret studs, flat back labret studs. If you're doing it at that angle where it's more outside the mouth, curved barbells can be used or circular barbells or rings. Understand, with the rings and the circular barbells, they're much bigger. They're going to be more of a hassle. They're going to have more contact with things. They're going to prolong your healing period and lead to possibly more issues than just a labret stud would. You always want to check the ends on these on a regular basis. Righty-tighty, lefty-loosey. I generally suggest weekly. Pick a week, pick a day of the week, and that's ball checking day, and just check it every single week. The other thing is downsizing. Generally, we pierce with a piece of jewelry that's too long to allow for the swelling. Once that swelling has gone down, there's really no reason to have that long jewelry in there, and you want to go to something shorter. Generally 4 to 6 weeks, as I mentioned earlier. Most piercing studios will give you a little bit of a discount when you downsize. As far as not charging a full price, or they'll even, in some cases, I've heard of people that just downsize for free. They never charge for the jewelry. Pain and piercing experience. Now, most people claim on a scale of 1 to 10, this is between a 2 and a 5. And the reason why there's such a variation is everybody's wired a little different. The placement of the piercing and what it comes in contact with, how many nerve endings are in that area, can greatly vary from person to person and spot to spot. Usually the ones that are done more of an angle and outside the mouth can be a little bit more uncomfortable than those that are done straight through. Also, there's the effect of increasing the pain increasing as you do more additional piercings. The way your body kind of works with most people is the first time you feel something, it's like, ow, that hurts. And then if you do that again, your body goes, hey, buddy, and it hurts a lot more because it's trying to get you to stop doing that. So there is sometimes an increase as you do the additional piercings, at least in one setting. Now, I usually do both of these piercings, beauty marks and labrets, with lip piercings with forceps. So I'll generally clamp the area, insert the needle in and through from the outside inward. If we're doing labret studs, then we push the needle out with a guide pin after we remove the forceps, thread the jewelry onto the guide pin, push it back through, close it up, and we're done. Rings, a little bit different. Generally, it's more of a direct, kind of the old school blunt against the back of the needle, or we use, if it's threaded jewelry, we use a curved barbell, except it goes in the other direction. Instead of inside the mouth, it goes from outside the mouth because you don't have a flat disc to worry about. Now, these guide pins can create kind of a little bit of gap temporarily. So sometimes you'll see a little bit more bleeding than you see on other piercings. That varies from person to person. Also, with lip piercing, especially the ones that are done more vertically, they tend to bleed a little bit more or have more of a risk to do that because you're more likely to kind of come in contact with a blood vessel. Usually have a little bit of throbbing and aching for a few minutes afterwards. Then it's going to be tender to the touch for anywhere from 3 to 5 days. If you bump it, you're going to know it, but usually you don't feel any other pain. Some movements, eating, talking, etc., is not going to feel good, and that's kind of an indicator that maybe you shouldn't be doing that at that time. Normal reactions see redness, discolorization, heat, tenderness to touch, inflammation, swelling, of course. It's also not common to see a white ring of tissue form on the inside of the mouth. That's scar tissue. It'll usually form around the ring, around the jewelry. It's also not common to see this kind of yellowish, nasty, stringy stuff hanging off of it. That's lymph discharge, or discharge in general. The stuff that hardens and crusts on the outside, in your mouth it can't harden, so it forms in these long strings, kind of look like snot. Leave them alone. They'll come off with their own. Now let's talk about anatomy. Most people have the anatomy for both these piercings, for the top and the bottom. And the only thing that may be, when we talk about anatomy or try to figure out what's going to work best for you, is the amount of contact you have with the jewelry on the inside. Especially if you don't downsize, it's going to be probably 50 times worse. Basically, it's best to, we kind of have to do this balancing act I talked about a little bit earlier about finding what's going to match, but also does the least amount of damage. But most people do have the anatomy to get these piercings done. It just may not be the best anatomy. Does that make sense? Now we move on to my final thing, what you should consider. This is for piercings. That's a lot to deal with, and I generally suggest doing them in stages. You can do even one at a time if you wish. There's no reason why you have to do all of them at once. The advantage of doing more, 2 at least at a time, is that it's going to shorten that healing time or that adaptation time in dealing with the piercings healing. Really, that's the only advantage of doing like 4 of these at once. This will affect eating and drinking, so plan accordingly and buy that stuff in advance so you have it on hand and you don't have to go running around all over town finding stuff. Downsizing can be very important because it's going to reduce the amount of contact the jewelry has with your teeth and gums. It also is going to feel a lot more comfortable and look better. So always downsize, plan ahead, budget everything for that time, and get it done. The other thing is nesting, because I kind of forgot to mention this. Oftentimes, once that piercing has gotten to the healing point and we've downsized, the jewelry will kind of rest or nest a little bit into the tissue on the inside. This is not a bad thing. It's not something you need to be concerned about unless the tissue starts to kind of engulf it or start to grow over it. You do want to check this, especially right after you downsize, to make sure this doesn't happen. And if it does, see your piercer immediately. Another thing to consider is if you have any upcoming events like dinners, speaking engagements, some school play or something, you're not going to feel comfortable eating or talking for at least a week and a half to 2 weeks. So I would suggest either postponing the piercing until afterwards or the dinner or whatever event that you have planned. Schedule accordingly is what I'm getting at. Speaking of scheduling, vacations or road trips or business trips, etc. Understand that when you go on vacation, you're being placed into an environment that you can't control. The other thing is that you're in an environment that is foreign to you and you have maybe possibly never had any exposure to before. So there's always a possibility that you're going to be exposed to a pathogen that you do not have an immunity built up for. The other thing, especially with vacations, is people like to swim when they're on vacation, and you're not going to be doing that, right? Lastly, let's talk about sports and hobbies and other activities. If you're involved with anything that involves a uniform or a dress code, like work including, they're probably not going to enjoy the fact that you get these piercings done. It may go against their code, their dress code, or what their general projection is of how they think you should dress, what have you. Check with your coach, boss, instructor, whoever's in charge before getting the piercings done. And if it's a case where they're prohibited, then either consider quitting or basically plan on getting this done once you're no longer doing those activities. Don't just get them done and show up and expect people just to accept it. Chances are is they're going to give you the option of either going home and not working or participating, or you're going to have to take the jewelry out. So it's kind of a lose-lose situation. Well, that's it. All I have to say today on Canine Bites. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and check out this next video.